The flu running rampant so far. A local hospital system is stepping up enforcement of visitor restrictions.
They tell TV5's James Felton just how many patients are there for the flu. James.
MyMichigan Health tells me the number of flu cases they're seeing are about 25 to 50% more than what they normally see this time of year.
We've seen a spike in our respiratory illnesses, in particular influenza A.
Paul Berg is the Senior Vice President and Chief Medical Officer for MyMichigan Health. He tells us it's been a bad flu season.
MyMichigan Health has in Midland at least, a bed capacity of about 275, 280 beds, and nearly 10% of those are being taken up by flu patients.
That's the reason why Berg says MyMichigan Health is enforcing visitor policies to keep patients and communities safe. Patients at their hospitals are allowed 2 healthy visitors or support persons at a time. Emergency department patients are allowed 1 healthy support person. And patients in outpatient settings such as doctor's offices, surgery centers, lab, imaging, or testing facilities are allowed 1 healthy support person. People exhibiting potentially contagious symptoms should not visit unless they are seeking medical care. If that's the case, people are strongly encouraged to wear a mask or consider a virtual visit as an alternative. Berg told us how these policies will be enforced.
Lots of signage. We have what we call guest, etiquette stations when you come in. So there's signs, there's present. We have, greeters at many of our doors that'll be, talking with patients. If we see excessive crowds up on the floors, our staff are trained to have those, tactful conversations. And of course, we know that there's always exceptions. There's sometimes that people may be in our hospitals end of life or, late life, and we have exemptions to those things. We understand the need to have family around patients.
Berg says it's still not too late to get the flu vaccine. It could save your life.
I've heard of at least 4 cases that we had patients with serious cardiac events, heart attacks, for example, that were caused by the flu. So, even those serious things hit our local communities. We talk about 40,000 deaths nationally in the U.S., but that means that things can even happen here locally.
And Berg tells us you can still get your flu shot through the end of the month of April. Back to you.
Thank you, James. For more information on the MyMichigan Health visitor policy, go to the hot link section at WNEM.com.